In honor of Brain Tumor Foundation of Canada's 40th anniversary, I present to you a PechaKucha presentation to share the various roads that led me here, working at Brain Tumor Foundation of Canada today. I'm going to share some personal stories of family, friends, career, and travel along the way, and how and when I started working at BTFC. This is my Aunt Shirley. Shirley had an infectious laugh, loved to tell jokes, loved Haagen-Dazs ice cream and family gatherings. I lived with Aunt Shirley for a few months at the beginning of my career back in the year 2000 when I worked at the Alzheimer's Society of Sarnia. We had a blast hanging out, and my dad loved that I was spending quality time with one of his sisters. In 2003, Aunt Shirley started to show signs of memory problems, repeating herself a lot, forgetting conversations, and word-finding difficulties. As you can see here with her lemon chicken recipe that she wrote in my recipe book, she was having difficulties with repetition and remembering the recipe itself. After various tests and scans, it was determined that Aunt Shirley was diagnosed with a glioblastoma. We knew nothing about brain tumors, and 8 months after her diagnosis, 2 surgeries, chemo, and radiation, sadly, Aunt Shirley died at the age of 60. We were stunned and didn't realize she could go so quickly. After working at the Alzheimer's Society, I pivoted to work for Pfizer Pharmaceuticals for their Alzheimer dedicated field force for about 3 years until the company decided to downsize and let go of 10,000 staff worldwide, including our resource division. I took this as an opportunity. I was in my early 30s and I had never traveled by myself and I had never been to Europe, so I decided to move to Prague, Czech Republic. Now it's the year 2007 and I love living in Prague. I worked part-time and taught conversational English to adults while exploring the city, countryside, and other countries, including Germany, Austria, Poland, and the UK. I met some amazing people and made new friends. Closing in on a year of being in Prague, barely working by choice, and the need to get back to working full-time, I moved back home to London, Ontario. I was open to really going anywhere in Canada for a new job and in my field, yet found a job posting for Brain Tumor Foundation of Canada in London, Ontario, and I was in shock. I didn't know anything about the organization, and as a family, we had never been in contact when Aunt Shirley was diagnosed with a brain tumor. So I entered into my job interview with one goal in mind: ideas around creating awareness about BTFC with the healthcare community. I clearly landed the job, and over 14 years later, a lot has changed. When I first started, we were a mighty team of 10, and now we are doubled in size. I was originally hired as the health information specialist and worked in that role for about 11 years. And for the last couple of years, I've been the senior health education engagement specialist, focusing on engagement and educational programs. I'm proud of the work I've done for our community, including launching and facilitating all the healthcare professional programs we now offer, including in-services, symposiums, development grants, and the ambassador program. I've had the opportunity to lead committees and national conferences while creating new programs and resources for patients, caregivers, volunteers, and healthcare professionals. And it's a tough world that we work in sometimes, and self-care is so important. The chance to build creativity into the work that I do within our working environment over the years is something I take pride in. And the tough conversations I've had with healthcare professionals, survivors, and caregivers is a reminder to the important work we do for our community. And I feel privileged that so many people have shared their experiences with me so that I can help them make informed decisions. Thank you.